I want to talk with you a few moments about why I feel that is of utmost importance for pharmacists, and especially those starting out and even in pharmacy school, to become involved politically. I know more and more a lot of the laws and regulations that are being passed really do affect a lot of your ability to care for patients and to promote yourselves professionally. I can think of one example back in the early 2000s on a federal level was the formulation of the Medicare Part D plan as we have it today. And of course, we all know what a struggle on a daily basis that a lot of pharmacists, especially those out working in independent community pharmacies, a lot of the struggles they have even getting paid for prescription medications. And a lot of that came out of those laws on a national level back in the early 2000s. I know one of the worst days in pharmacy in my career was January 1st, 2006, when a lot of the Medicare Part D plans went into effect. And I know it was just total chaos because you suddenly had this population that had been paying cash, hadn't had a lot of things covered. Now suddenly they were all run through these insurances, and those changed from month to month in some patients, and then now you see them change on a yearly basis, and the plans fluctuate. And a lot of that arose out of the Medicare Part D, the formulation back through committees in Congress. And I know one of the problems back then was that there really wasn't an overall concerted effort to get the pharmacy community to have a centralized message. You know, there were a lot of conflicting views about some pharmacy groups were pushing for the Medicare Part D coverage. A lot of them had some reservations about the way it was implemented, especially running it through the PBM model as we have it today. So that another example would be on a state level, and that would have to do with a lot of the pseudoephedrine laws that have gone into effect in recent years. I know when those were first formulated, the idea was to try to limit the access to those that would abuse the pseudoephedrine or try to put them out on the street to use in the manufacturing of methamphetamines. And I know a lot of good came out of those. You know, people were still able to get them that had a medical need. But since then, we've kind of had to tweak that law a little bit. And one example I have was when some of the manufacturers of pseudoephedrine products and then even the larger chains wanted to try to increase the access. But what they did was go about that in the wrong way, and it would have put a huge loophole in the law that we had in place and allow a lot of the pseudoephedrine products to get back on the street in large quantities. So what we did was a lot of the pharmacies had their staff members, even a lot of concerned citizens, and then pharmacists themselves flooded the capital, the state capital, with phone calls trying to voice their opposition to this change in the law that would have created, you know, this huge loophole in pseudoephedrine sales. And what we saw from that was that with a large grassroots effort of pharmacists coming together, having a centralized message and getting that point across, the state legislators took notice, and they were like, you completely jammed up our phone lines back then, so we see what an impact your profession can have when you all get involved. So I think that's something that we can take a positive view of and go forward in the future to show just how important it is to become involved politically.